the athlete, the client, is led through a DIY objective-based testing.
So at what point is mid to late recovery when we're talking about ACL rehab?
I didn't think that I had an artistic bone in my body when I was getting out of PT school. I'm at a clinic that is doing it better than most, and we already had so much that we needed to improve in order to try and just elevate our standard of ACL treatment.
Awesome. Well, Akil, thank you so much for coming on the podcast. I'm really excited to get into everything in regards to ACL care, but also what you've been working on. So thanks again for coming on.
Yeah, man. Thanks for having me.
Well, before we get into a very popular area that physical therapists and rehab experts like to dive into, which is ACL rehab, I want to make sure everyone kind of understands your background and where you've come from and why you became so curious with ACL rehab. And so why don't you just speak to, your background and like where you came from, and then maybe why you got so curious with ACL rehab.
For sure. So I grew up in Georgia. Prior to entering PT school, I was a exercise and sports science major, and I grew up actually powerlifting all throughout high school and then a little bit into college before I ruptured my pec and had to hang up the weights a little bit. So had some experience into personal training, and I've always been in like the fitness world. So when I actually entered PT school, went to Drexel University, the popularity of treating ACL athletes, I think, fits really, really well with people who deal with like strength training. Obviously, people who've done fitness in the past, but there's a really big overlap between the type of rehab that you do with ACL patients and then the personal training world, and also combining the more like cerebral aspect of what rehab can be, particularly in like the early to middle stages. But then you have so much like strength development, performance development associated with the rehab that there's just like a really, really natural fit between those things that I enjoy. So it's definitely like my number one interest that just grew as I learned more about the challenges facing the current rehab environment and the opportunities to just try and do it better.
Nice. And you also did a sports residency, am I right?
Correct. After I graduated from PT school, I did a university-based residency at Drexel as well, which was a 13-month, really intensive process that just was a deep dive in clinical, critical decision-making, doing research, teaching, and just really diving deeply into like the next tier of how you think about going about rehab, which was a really good combination of something that naturally I was good at, which is the exercise prescription aspect of recovery. Again, given the background that I came from, but anybody coming out of PT school is not an expert at how to think about rehab. So it just really helped to up the quality of treatment that I was able to do from both of those sides.
Yeah, I think the quality and the cerebral aspect, like you're describing, really comes from after you start treating and what you kind of do in your continuing education, whether that is doing residency or that is just doing continuing education on your own. And for those who may not understand ACL rehab, maybe they've never heard of it before or they never gone through it, would you describe ACL rehab as just a very cerebral process? Or maybe is there maybe like 2 or 3 words that come to your mind that you would maybe think about in regards to like the overall process of rehabbing from an ACL injury?
I think that people who work with a lot of ACL athletes really appreciate the heavy nuances that's associated with the recovery. But others kind of like outside looking in might think that it's a little bit more simple than it actually is. But I mean, I truly see a very high volume of ACLs in my current practice. Currently, I think I have maybe around 10 on my caseload, and every single one of them are different, from age groups, their issues that they have in the beginning of the recovery, what it looks like as they progress from the mental side of what they're dealing with, from others who like you have to try and hold back from doing too much. I really, really, really enjoy the nuances of that recovery. So it's entertaining in that way and challenging on a lot of levels, because I still feel like I'm learning a lot despite having so much constant frequency in my treatment.
Yeah. And what's even more interesting is that when you're dealing with ACL, a lot of the time, these patients are within some level of sports. And so you have to kind of manage, the sport demands and, be dynamic and being able to, again, to your point, deal with the nuances of every single patient that comes into your clinic. And overall, I suppose since you've been working with patients for so long now, I guess, how would you feel that the progress of ACL rehab has been made over the past, like maybe 5 years or so? Do you think we've improved? Do you think it's something that we need more work on? I mean, obviously everything needs more work, but do you think that we made a little bit more progress in the past 5 years since there's been a little bit more awareness in regards to ACL rehab?
In that short of a time span, I don't think that I've noticed such big movement forward. I think that awareness as a whole has always been up there because ACLs is researched all of the time, way too much, honestly, and it's kind of like watered down the quality of evidence that comes out because you try and look up updated ACL research and there's like 10 new articles that was published in the last week sometimes. But I think that the issue is not so much identifying certain pieces associated with recovery, it's more so implementation. And that's the slow aspect that is very, very regional. Certain places are doing it better than most, but on average, there's just like really slow adoption into changing what the research has already shown and putting it into practice so that we can really kind of elevate the standard of that ACL recovery process.
And why do you think there is this lapse in, applying what is known to clinics all over the nation? I know maybe this is a little bit of insight, but I have noticed that after you graduate PT school immediately, I didn't feel like I had all the tools necessary to bring someone from, end of rehab to like all the way to 9 months. And if not, beyond that with an ACL rehab. And do you feel like that might be a limiting barrier for new grads or even physical therapists are implementing what's current in the research and what other ACL pros are kind of saying and preaching about?
Yeah, like there's so many variables that contribute to why we're in this current state. And I don't really look at it from like blaming the providers or like the surgeons or any one specific group.
Mm-hmm.
It's like it takes a lot of effort to try and push through the current barriers that kind of shackle us from how we're able to do that treatment. For example, I came from a university-based treating background where I had zero insurance issues when I was dealing with an ACL athlete. I could take them from prehab to post-op and go all the way through until they were cleared to go back to sport. That is what I naively thought was normal until I left that university environment and saw what the general outpatient world looks like, where the goal. All right, so I'll take back when I said I don't blame any specific individual. I do slightly blame insurance companies because the goal of the insurance on average is to try and pay as little as possible for that course of care. And that creates a lot of issues in regards to people ending their rehab very, very early in the process. And the providers, which have a lot of other things to deal with, a lot of other patients, a lot of challenges in being able to kind of fill that gap. You give your best recommendation to them while they're in front of you, like, yeah, keep on working on stuff, keep strength training, try and get with a trusted source to make progress, but it's impossible to really give the type of progression and nuances that need to live within that post-rehab or even weaning rehab environment so that somebody can progress as quickly in their mid to later stages of recovery like they were in the beginning stages of recovery. And that's just a piece, even like the surgeon side. I think that a majority of ACL surgeons recognize the importance of having objective information to base their clearance decisions off of, but they're not going to chase it. They aren't going to fight with a patient to say that, no, you can't be cleared because I haven't seen where your limb symmetry is at, or you say that you're doing great. I haven't heard from anybody else to say otherwise. I can't do an hour's worth of testing in my office here. All right, you're probably good. And that physician only sees them 3-4 times in their entire 9+ month recovery. So it's like it's it's a tough situation to kind of plug all of the holes that exist into getting that kind of gold standard care.
Right. Well, I think the common theme is there's a lack of communication. We're not having, no one's talking to each other. And even if they are made aware, let's say the surgeon is aware of all these factors, no one's going to feel like they're going to probably be able to make a huge difference, because you're not just dealing with the individual therapist, you're dealing with a system, right? And so it makes it extremely difficult to, even from a physical therapist standpoint, to be like, okay, we need to work with the insurance, but then we need to work with the surgeon, we need to work with the patients, we need to work with the primary care doc, we need to work with everybody. And it can definitely be overwhelming, especially if you don't know, is which factor is the biggest contributing factor. And I guess overall, where do you think PTs should start in regards to trying to change this idea of like creating better communication? Is it talking to surgeons more often? Is it trying to express to insurance companies that, this is really, really important? Or I guess like maybe speak to maybe what a solution might be.
So I think that one solution is first to kind of empower the clinician with things that they can have a better discussion with, as in having clinicians be a little bit more objective in the type of testing that they're doing, so that they can point to the individual, to the surgeon, to the athletic trainer, that this is why this patient should still be at X phase in their recovery process. And I think that those helps give like better springboards towards it. That's the type of information that we point towards when we discuss with insurance companies for why we should have more coverage, et cetera. But even when you have great relationships with physicians, they understand the importance of it, but oftentimes they're going to put it back on us to really kind of like navigate the discussions with the parents, with the athletes. Like, the patient has to be informed enough to kind of navigate that care process on their own, because if the parent pulls hard enough, if the athlete pulls hard enough, most of the time they're going to win, because there's just not enough bandwidth from the providers to kind of push back on a lot of that stuff a lot of times. So there is a lot of power in the provider to help navigate those things and educate the individual to a higher level.
Did you have that power immediately after PT school or even after your residency, or did you feel like you had to develop this power to be able to speak up and, be a provider who's able to communicate effectively?
I was lucky in the type of clinic that I landed in, that we already had a reputation of being like the sports place. There's a group of surgeons that constantly refer to us and had already had 10 plus years of a relationship with this company. And then when I came into it as this person who was changing up the way that my clinic was treating ACLs, I had a really warm welcome to sit down with these people, give a presentation towards them for what we're doing, why we're doing it. And it was a good relationship as a result. I don't expect that to be other clinics, other environments, situations. Some will, some won't. So it's tough to navigate that sometimes, but I think that whenever you're met with some of those hurdles, there's a way to try and kind of finagle yourself inside there, but it'll take some figuring out. Luckily, I didn't have to push too hard though.
Yeah. Do you have any recommendations for clinicians, or, even maybe a patient who's looking for somebody who is an ACL expert, or has an environment that is conducive for, making sure that a patient or their provider will bring them to the point of destination, meaning their return to sport with the least amount of injury possible?
Yeah, like if I were a patient trying to navigate that type of environment, I think that the first starting point is to try a more sports heavy style of clinic, which pushes through certain barriers from the patient side of that clinic. Might not be the one that's in the closest proximity towards them, but on average, they're going to be getting a higher quality of treatment from people who have more exposure to working with ACLs on a day-to-day basis. So that's kind of step one. And then looking at the credentials of those PTs is not always going to give you the right answer, but it's again another good springboard in regards to just kind of hoping that that individual is going to have that alignment in the way to work through this very athletic type of rehab in the right ways. And then asking questions, something as basic as what objective measures are we going to be tracking through the recovery process? And if a therapist is not able to kind of answer those questions, then it will kind of showcase that that's not the right environment for them to go into. So that education before the injury happens for the patient being a better consumer of healthcare is a good place to start.
Yeah. And, and say you don't have access to care and, we're discussed, you live in the middle of rural, I don't know, Minnesota, and you don't have access to care. There are now providers providing interesting things. And you're one of these providers who are now providing online ACL care to patients who may not be able to continue with ACL in person, or maybe they have a provider who doesn't know how to bring them from the end stages, or like bring them through objective measures to make sure they're hitting all the check marks. So were all of these motivations with access to care, lack of communication between surgeons, as well as just what you've seen in other clinics, your motivation to building ACL Care Pro?
100%. Like it, going back to when I left the university environment to working into the outpatient environment, it was a big shock in regards to like this. I'm at a clinic that is doing it better than most, and we already had so much that we needed to improve in order to try and just elevate our standard of ACL treatment. When we put some of the systems in place at my specific clinic to track these patients better and use what we had, which was called a return to play, like a bridge program. It was a landing place for patients who either exhausted their insurance requirements or got to a point where they're really good with all the functional stuff and really just needed that kind of like return to sport training, where they would go work with coaches. Those coaches are still tracking the same objective factors that's necessary to minimize the risk of re-injury and to help make this athletic patient become more athletic, which I think is really like the two main pieces that need to be incorporated in ACL rehab. Make them more resilient so that they're not going to get this injury again in the future, and make this athlete be a better athlete, a better performer, a better mover as they're going. So what we were doing in person was something that very few people were utilizing or have access to. And it made me try and figure out a way to raise that quality of care outside of just our local region. Really trying to combat like the places where the expert kind of sports clinics don't exist. How can those patients still have something to end up being at a much, much higher floor? So that's really kind of the focus of this return to play ACL Care Pro stuff. We are aiming to really, really raise the floor of what ACL recovery would look like, and to give more tools to make the people that are doing good do even better.
And now you describe accessibility. How important to you was that everybody's going to be able to access this app, or maybe just go into the details that way everybody can understand like what exactly ACL Care Pro is in regards to accessing it, and then like how important was access when developing this program?
Well, access was the whole point of the program development. In my mind, all ACL patients should be doing a return to play progression. So return to play, kind of similar, you might hear people describe it as return to sport, but working on things to become better movers and really kind of get their strength, mobility, speed, power. Because if you got an ACL injury, for the most part, you're athletic. If you got surgery for that injury, again, for the most part, you're athletic. The top tier of people, those professional athletes, they have all the resources in the world, and overall they're going to be landing at a good place. For everybody else who has certain resources available towards them, there's so much that you can and should be working on in ACL recovery that one individual can't really provide. Meaning, even if I'm taking an athlete from start to finish, I'm going to be seeing them in the clinic 2 to 3 times a week, and I'm going to be training them on those days. I still want them to be doing work outside of the clinic. And when they're in with me, I want to be able to focus on the stuff that they need an actual person. Therefore, I don't want to tell them to go do 15 minutes of squats, go work on their knee extension, go jog around for 20 minutes and work on their endurance. Those are things that should be done outside, prescribed and progressed. But I'm not going to have the time to program somebody for 4 months worth to do those things outside of the clinic. So I created this ACL Care Pro program to try and focus on what I call like the 80%, the stuff that people should be working on regardless. And that if people have access to more training, more rehab, they're getting that 20% from the provider. They're getting the more advanced stuff. But for people who don't have access to that, they're still getting a whole lot better than the 0% that they were getting before. So that's really like that gap that we're aiming to fill by having this return to play mobile program that people would engage in later in their mid to late recovery.
So at what point is mid to late recovery when we're talking about ACL rehab?
So there's a couple different starting criteria. Somebody should be at a point where they don't have any pain with day-to-day activities, going upstairs, squatting, their knee range of motion's at a great place. They're not really struggling with a lot of swelling. And at that point, they're also cleared to work on activities like jumping, running. Most people will probably engage in that mid to late stage, already have done those things. But when you work with a lot of ACL athletes, you end up finding that maybe they should not have been working on them as early as they might have began. So those aren't requirements. It's just they want to be cleared to be working on those things. So you typically see that at about like 4-ish months post-op, but we kind of have a start range typically of 4 to 7 to 8 months, just depending on the progression of where the athlete would be.
Now, as you're going through the ACL Care Pro, you mentioned earlier that objective measures are really, really important. Are you, as a patient, going through like objective testing or have like little mini goals that they want to kind of, that you have set up that they should be shooting for, so that way they know, okay, this month, this is my end goal. I should be doing a single leg squat, or this month I'm doing a triple hop test, or however, whatever goal it is. Was that part of the motive? Did you include that within the ACL Care Pro where you're building objective measures to shoot for?
Yes. So it's a 4-phased program. And at the end of each phase, the athlete, the client, is led through a DIY objective-based testing. They're not necessarily told or instructed towards what that test would be. The purpose of that is that we don't necessarily want people to train to pass a test. We want people to train, get better, and then be able to pass these kind of like checkpoints along the way. But we focus on the objective measures that is going to point towards the skills that's known to reduce that re-injury rate. So quad strength test, hamstring strength test, and then various hop testing along the way, from single hop, rotational hops, triple medial hops. And then we do side planks 4 times through various degrees of intensity to showcase some level of core competency along the way. And those get harder as they progress from phase 1 to phase 2, 3, 4, and then with the hopeful intention that even when somebody finishes our program, they would still get that return to sport final clearance. But if they don't, they passed a good marker that shows that they had a certain baseline level of competency.
So rather than them being like goals, just in general, these are specific objective measures that you found, developed, and seen to indicate like this is when a patient should progress to the next step. They're not just like throwing darts at a dartboard, correct?
Exactly.
Now, when you said good earlier, you said that you were doing ACL rehab and you noticed that it was better than a lot of the other clinics in the area, and you thought that your rehab was better. I'm not trying to put you on the spot, but I think it's just interesting because a lot of providers probably think that their ACL recovery is good. And I guess, how did you make sure that your ACL protocol within the ACL Care Pro app is good, and that you are making sure that it is a step above and beyond what other clinicians are doing?
For sure. So my biggest kind of like line in the sand of what makes somebody a good ACL treater versus a not so good ACL treatment provider is the objective measures that you're watching. And when I say objective measures, it's different than just a clinician doing a progress note where they're doing MMTs, maybe of hip, checking range of motion and things like that. But the true like limb symmetry measures that is so integral to a ACL athlete's progression going forward. So if you're looking at these things, hopefully you're having access and using things like a handheld dynamometer to be able to get some of those isometric true strength tests, because I'm not a weak individual, but I'm not going to be able to figure out how strong somebody's quad is without getting a machine that can actually kind of quantify that for me and doing the hot test and trekking those things regularly. So for us, we start those testing at 8 weeks post-op, typically for an isolated ACL. And then every 4 weeks throughout their entire course of care, we're looking at that again. So that if at 5 months post-op they pass, doesn't matter, we're checking it at 6 months post-op, because there's so much fluctuation that can happen. Their uninjured side can get stronger than it was before, and then kind of create that discrepancy again that they had earlier in the process. Or they might start slacking on some of the strength training that they were doing in the past. Maybe they got into a more advanced skill and started to do more asymmetrical loading that we didn't see in the course of their treatment, but then got worse as they're going on, and the limb symmetry changes again. Like that level of objective tracking, I think, is necessary. And if you're doing that overall, you're probably a really good ACL provider. There's so many different exercises, skills, cool things that you can do with a patient. And I think that a majority of practitioners do those things, are aware of those things, but that doesn't really qualify as good versus not so good in my eyes.
Was there any point that you maybe got the imposter syndrome? Like, am I actually good at this? I know for myself, I'm always constantly asking myself, like, am I providing good care? Like, am I using objective measures? Am I making clinically relevant and important decisions and making my patients better, as the best I can? And did you ever feel like you ever had imposter syndrome or any kind of like self-doubt in like what you're creating and like how your rehab is actually going?
Definitely. Like, there's nothing that keeps you to task, keeps you honest more than tracking their objective measures. Somebody who does a quad test at 4 months out and maybe kicks 63% side to side. You go through a whole month, you think that you're nailing it in regards to they're doing higher weights, they're doing more complex movements. You test them again at 5 months and they kick 63%. This happens not so abnormally. Those things occur. Inhibition that you're dealing with and don't necessarily even notice, but it's just like it makes you ask those questions. And again, like, I'm a power lifter, personal trainer, I bodybuild, and I'm like, if there's one thing I'm freaking good at, it's getting somebody strong. And they just went an entire month and had the exact same kick on that quad. And it pushes you to do things better. Maybe I need to do a different style of intervention. Maybe I need to bring back NMES into the program because there's that activation deficit that I'm not noticing. And that same challenge is also the same excitement that I have in treating ACLs, because it's always different. Some people, like, you can't stop them from making gains. And other people, like, you think you're throwing the kitchen sink at them and it's just resistant for a variety of different reasons that you got to try and figure out.
No, I like that. I like that a lot. And I've run into similar issues where I come from a strength and conditioning background as well in personal training. And it's like, again, if there's anything that I know, it's definitely how to get someone very, very strong. But again, you even like with a single leg squat or a kick or something like that, and you're like, how the heck did that not get any better? You're like, what in the world? And I've found this to be true just from like something that I've observed, but maybe I don't know if you've seen this as well, but I'm realize that the body is extremely specific in what you give it. And so if you're training in single leg squat, or let's just say you're doing a lot of strength training exercises, whether it be a trap bar deadlift, whether you're doing like a single leg squat, but when you go over to translate over to a kick, you're not necessarily going to get better at a kick motion. And have you noticed that, like, you really have to be very specific in what you want the body to do? If you wanted to get better at kicking, you have to train kicking. If you have to get better at, being powerful, you have to train power. Have you also noticed this as well?
Yeah, there's so much like importance of specificity of training in order to kind of build those skills. But I think that goes back to the concept of trying not to train somebody to pass a test. And I
Mm.
look at something like a open chain knee extension, an open chain kick, as that is probably one of the very few ways that you can truly isolate just what somebody's quad capacity is. Yes, there's some other factors in there, like their rate of force development, but that raw strength number, if somebody's getting better on a closed chain movement, that it looks like they're getting stronger, but I see that that measure doesn't change, that's telling me that they're compensating in some way.
Mm.
Maybe I'm not noticing that there isn't enough anterior knee excursion and they're relying so much on their posterior chain. Maybe they're just doing little things that to the naked eye, I might miss in the speed of what's going on in their training, that it just helps me to focus in on a little bit more. So that's how I look at those measures to help kind of orient me a little bit better.
So the specificity of like bringing it down to like, this is a quad movement, but the quad movement isn't getting better, but let's say the deadlift is getting better. It could indicate that perhaps they're just compensating in some way. It may not be a bad compensation, but clearly they're not using the quad in this manner like you would hope.
Correct, correct.
So being as specific as possible, I like that a lot. Well, overall, do you use the ACL Care Pro to kind of get back to that? Do you use ACL Care Pro for a lot of your patients as like a point of like, okay, start going through this program and then we'll follow up in a couple of months? Or like how are you balancing this program that you develop um, with the patients that you're actually seeing in person?
So all of that is constantly going to be evolving. So this app has been in development for probably close to 2 years. And we just launched earlier this year. And it's already been a huge learning curve. And like the gold standard of return to sport training is an in-person kind of like bridge program with an expert who understands ACL rehab and can kind of navigate a very, very specific progression towards that athlete. If you layer in the app on top of that, yes, they're going to be able to get some added benefits from that, but those aren't my priority people that I'm trying to get. The patients that I'm working with in my clinic as a full-time clinician, I'm pushing them to get into our in-person return to play because I think that that is better than the mobile thing that I created. Our people are trained to do that good work. And if they're going to be spending even more money on top of it and want the app, absolutely grab it. But I created this program to try and reach the people away from my immediate vicinity. And it's been cool in the learning process in regards of like putting this out on social media and getting interest from people in Canada, India, West Coast, just like so many different places where I would have never found these people in my entire life, but there's so many more pockets that this could try and benefit. And there's discussions that we're having with the company that I actually work for of just trying to integrate this more into those more kind of standard outpatient orthopedic practices. But my vision is so much greater than where we have just launched in order to try and just have this be something that's accessible for people everywhere.
Well, I love that the original motivation behind the app was to build something for people who don't have access to care. And after that, you thought about how can I get this out to people, right? It wasn't like the origin of this was like, how can I make more money? Or like, how can I build something that can, bring more awareness to me? You thought of like, there's this issue that's going on. I'm going to solve this issue. And then I'm going to build something around that. And for maybe one thing that happens in, physical therapy, also just in healthcare in general, is this idea of like burnout. And do you feel like finding something that you were passionate about to fill a gap and help patients within healthcare help to curb or maybe prevent you from being burnt out with what you're doing?
Yeah, you nailed it. Like I have always liked the idea of creation, entrepreneurship, just kind of like trying to elevate where I feel like my potential could hit. And working as a clinician is a lot of work to give so much energy and effort to so many different people. But when I was able to find something that I really care about in regards to this like ACL patient management, to come up with a solution that when I first started, I had no idea what this was going to look like. All of the skills that I didn't have that I needed to learn in order to kind of bring it to existence just lit a fire underneath me and exposed me to things that I didn't even know that I had interest in. For example, like I do so much video editing to create this stuff, and I didn't think that I had an artistic bone in my body when I was getting out of PT school. My wife is actually an art major, and like when it comes to art, I just punt it all off to her. But like I like video editing. I like taking music and syncing it to an athlete making a cut, letting a beat drop when their knee goes into a certain position. Like there's just so many like cool things that came out of this entrepreneurial route, and it kind of showcased where I know that I want to kind of take more of my professional career and to be able to provide a service to people further out than just where I'm living.
I love that. And I've found the same thing. I like editing, and obviously I had this podcast, and this is kind of something I didn't think I had any kind of art or any kind of anything outside of movement motivation or any kind of skill.
Yeah.
And then all of a sudden you find this and you're like, oh, this is interesting. This is cool. I like spending time doing that. And it's been definitely a learning process. But would you say that's probably been the biggest thing that you've learned about yourself over the whole span of this journey with creating an ACL Care Pro app, and also trying to, again, help more patients in areas that maybe they don't have access to good ACL rehab?
Definitely that and also like I always looked at myself as being a resilient person, but I think that you really test that when you do something that is so outside of your comfort zone. And doing this entire process, and even now there's so much more to go, and just running into barrier after barrier after barrier, and just trying to figure out like, how do I communicate my message better? What's the next best way to try and get people to understand? Like you go crazy in your head knowing that like, I know this is the right solution. I know that so many people need this, but how do I make other people understand this in the right way? And I have found that resilience is so necessary, and it's a skill set that I'm never going to lose, or else that means that I'm going to fail. So that's something that was built out of this process, and was just really cool to kind of reflect on and keep on relying on, because there's more of it that's necessary.
For sure. I like that idea as well. Resilience, building the ability to just tolerate things that you maybe don't want to do, but will ultimately get you to where you want to be, right? Like that's kind of the mindset with that. With physical therapy in general, maybe other healthcare professionals can also relate to this, or even people who aren't in healthcare. One thing that I have found also with physical therapy is it's not only after graduating, becoming a doctor of physical therapy is a milestone, but it's not the end of the journey, right? It's not like you become a physical therapist and all of a sudden, everything's fine, everything's great. It's like all of a sudden you're looking for kind of like the next thing to do. And I've attributed it to something from like stand up or improv, where it's like, yes. And like, yes, I'm a physical therapist and I'm also this. One, I want to kind of get your opinion on like, do you think that all physical therapists should have something that they're niched in to work on, and so that way they're continually getting better at something? Or do you think being a doctor of physical therapy is just enough, and you're able to just kind of, navigate that if that's what you choose?
It's tough to answer that for everybody. What I can say is like the way that I think and go about stuff, like I think that there's a lot of value into finding that niche, and then broadening outside of there, but then also not trying to be a jack of all trades. And I've carved out some of those niches, obviously into the ACL world, and then also with my background into like working with a lot of weightlifters and those types of strength athletes. But if somebody comes to me with a neurological disorder, I'm immediately telling them to turn around and go somewhere else. So I think that a lot of outpatient clinics try and take in everything, and that's part of the issue with ACL recovery, in my opinion, because these general outpatient clinics that don't know how to really serve that patient population as good as they need to be served, kind of, it's doing that patient a disservice. So I think that by finding that niche, finding the stuff that you care about the most is the best way to not do our patients a disservice.
Yeah, just understand when to refer out, right? Like that's something that we learn early on is like know when to kind of refer out. When this is something that you don't understand, you got to refer to maybe another clinician that knows how, whether it is a physician or whether it's a chiro, or even if it's a physical therapist who specializes in somewhere else. You have to understand the scope of your own limits of your skill set. And that is, I feel, has something that I've tried to develop, and trying to be able to understand, like, what does this patient need? What does this individual patient need? Just because, I'm not able to help them doesn't mean somebody else can't. Right.
Mhm.
And so, with this ACL Care Pro, I love, because, it might be an option for somebody. If this is something, if you're a clinician who struggles with ACL care, maybe getting into strength training isn't something that you're familiar with, or the whole progression of ACL care isn't something that you're comfortable with. This is an option that you're able to refer a patient to, and they'll be able to get better and feel better. And they'll thank you for that, right? They're not going to get angry because you're like, oh, I can't fill this gap. They're going to be like, well, thank you for pointing me in the right direction, instead of just being like, oh, well, good luck with that.
Exactly, exactly. So it's like, this is one solution towards a specific injury that I think, like, there's so much opportunity to do those same things in so many different injuries that we're exposed to in that PT environment. So I think that this will be a learning experience for me personally of how this can be adopted for clinicians into general practice, and hopefully be a blueprint for other entrepreneurs, other people who have expertise that they want to showcase and kind of reach outside of that. Because I do think that part of healthcare is moving towards these types of solutions, with the continued bearing down of payment providers trying to pay less for that in-person care. How do you still deliver a gold standard treatment quality in more creative ways?
Yeah, well, you bring an interesting point up, and I hate this idea, but it's like, we have these hard constraints with insurance, poor communication, healthcare professionals not being able to perhaps provide the care necessary for patients. And with all that bad, it seems like there's a lot of good that comes from it, right? Like, all
Mhm.
this pressure from the outside has allowed us to basically start to create and be creative and create amazing things. And do you think without that, a lot of this wouldn't, if everything was super smooth, maybe you wouldn't have created this idea. Maybe this would never came into existence. And do you think, like, part of, creativity or good ideas come from bad situations such as this?
I 100% agree. It's like, it's almost a mantra of life. Like, something comes and hits you, and you just got to figure out how to bob and weave and try and counterpunch. And all of these counter punches is how innovation keeps on being created and opportunities are found. So I think that although it is annoying, frustrating, and it's tough because not everybody is capable of handling those types of punches, but out of those challenges comes just cool new ideas that hopefully just kind of moves the entire industry forward.
Yeah, and thankfully we have that opportunity, right? Thankfully we're able to do that. And you mentioned annoying, and one thing that physical therapists always are annoyed with, their patients' ability to do exercise. I'm curious to hear, what is your efficacy rate in regards to patients doing their exercise program with ACL Care Pro, and have you learned anything interesting about exercise compliance along the way?
Yeah, it's an interesting question because uh, with our app just launching, I don't have a tremendous amount of data to be like, we have a compliance issue or don't have a compliance issue. The 20 plus people that's kind of gone through this program in general are doing well, but we've already learned in that beginning stage that we needed to give more guidance to people. And before this app existed as, this app is out there and we're just going to expect people to go through it. Life doesn't work like that. So then we added in like a communication method to be able to check in with people, give motivation, kind of like answer questions that inevitably come up when you go through that stuff. But I kind of look at this virtual journey similar to how I look at the in-person clinician journey. And the way that I think about patient compliance in the clinic is that patients don't like being in pain. And on average, 9 times out of 10, the reason that they aren't compliant is because they don't understand how the solution is going to help them get out of a situation that they don't want to be in. So when I come up with those barriers, or if somebody isn't going through the program, if they're not doing my exercises, maybe my exercises are boring. Maybe I'm not communicating to that person like how this specifically is going to be solving their issues, or maybe what I prescribed isn't actually solving their issues. So I think that bob and weave kind of aspect is going to be something that's always surmountable, and figuring out what's the right way to help that patient understand. Is it via education? Is it via changes in the program, that this is what they need to accomplish the goals that they really want to work towards getting?
And is that communication piece what has allowed you to try to do that? Like, are you providing like maybe little notes of like, okay, this is like maybe this month, this is a primary focus that we need to focus on? Are you trying to communicate to that and like be like, hey, these are the exercises that are going to bring us to the next goal? But you also brought up the point earlier, like you don't want to make sure, you don't want them to be like a checklist like you were describing. So like, I guess, how do you balance the idea of like keeping the patient informed of like what's the next step or where we're going, and not like checking off boxes as like a checklist?
Right. In the actual programming, there's videos for everything, not just like how to do the exercises, but then even like intro videos for each category of movement that they're doing. Why are you being led through warm-ups? Why are you going through this workout phase? What type of progressions and what's the purpose of them as you're going in? So we try and bake that into the programming that they come into. But then with the added communication aspect, we try and make ourselves available for questions, issues, try and like if somebody stops logging for a certain period of time, we ping them in regards of asking like, is there any issues? What's going on? And that is definitely always going to be like a learning curve as we're going in and trying to figure out like what these people are thinking. And also part of it is building trust with these people that we've never met, because if you might have a patient that you're working with, some of it is they're going to listen to what you're telling them to do because they trust you as a provider. But when you're creating a virtual product, it's so much harder to build trust with these people that you've never met, and navigating that world of how to communicate that and build that to get that desired outcome is something that I'm still learning and working through to get.
Yeah. And it's understanding human behavior and trust. So that way you can develop a product that, again, going back to the original idea of all this, is to help patients and help people who are in need and make sure that they're, it's not to trick them, right? Like, I feel like sometimes people think of like getting them to trust them, like you're trying to like bait them into this idea, but it's like, no, like I'm understanding how people work. So that way I can help create a better product and help more people and, get the name out there. And what has been the feedback so far? What have you heard? Some of the negatives, maybe some of the positives of ACL Care Pro?
In general, overwhelmingly positive in regards to people kind of understanding where this lands as a solution provider. And that specifically comes from like the providers, the people who are kind of educated from that standpoint. And from the actual patients going through this, one athlete specifically, like her feedback at the end of the program is that she absolutely loved the warm-ups, which was interesting. It's like, yes, it's a huge piece of the programming that they're doing so regularly, but that was her long-term takeaway in regards to she went through her entire high school and into her collegiate career of playing, but just felt like she never really understood how to warm up, and still taking those things to make her playing be a little bit better going forward. So those are like the little wins that kind of come up within it. But as far as the negatives, like I think we identified early in that process that part of the issue with compliance is that we need to continue to be guides and coaches to these people along the way. It's not good enough to provide a mobile programming that's supposed to last 4 months long and then never check in with somebody along that process and just assume that they're going to be doing it right. So going through things like that and just working on little bugs and kinks that come up with such a huge program, so that they can log their exercises properly and that there's not a lot of redundancies that are going through on there. So always a lot of little things. And I'm sure that all of the feedback that we've gotten so far is just going to be kind of like icing on the cake for what's soon to come. So we will see.
Yeah, it's exciting, right? It's all, everything's new and unknown, right? And you don't know what's to come, but something that you're going to continue to work on.
Exactly.
Now, have you had a lot of PIT providers also provide feedback and maybe just use it as a way to like educate themselves on like what a good ACL rehab looks like? And you had mentioned patients kind of use it, or providers rather use it as an education piece.
I don't have a lot of providers using this program right now because it basically became a tool for providers last month.
Mm.
When we first released, it was kind of like this direct to consumer, still like with this just coming up, like doing this soft type of release to get to that point. So a lot of the feedback has kind of come from my internal PT group, meaning that we have about 12 PTs that work from my immediate kind of sports specific company that's all had an opportunity to kind of dive in, people that I've mentored through residencies that have been able to kind of tinker through this and see through it. And I take their praise with a grain of salt because they already know and recognize me of kind of like that ACL person. So I'm open and ready to kind of hear from people who don't know me to kind of give some of that feedback in regards to some of those things. So again, overwhelmingly positive, but so much more left to learn to kind of go through that process.
Absolutely. Well, we've talked about the physical capacity of patients to be prepared, and also providers should be prepared in regards to helping their patients be ready for return to sport. But is there a mental aspect in regards to making sure that the patient feels that they are mentally prepared to return to sport or return to play through this ACL Care Pro program?
Yes and no. And what I mean by that is I think that there is a large amount of the mental strain of this injury that comes from not being physically ready.
Mm.
A lot of fear that comes up in people not doing movements right. When you pull them in, when you test them, when you do these limb symmetry metrics, they're performing very poorly on them. And you can't separate those two things. So when you're working on the right stuff, when you're being tracked and seeing like your progression go through that process, I think that inevitably that kind of helps combat some of the mental strain that comes through with this injury.
Mm.
But something else that we are aiming to provide through our programming is access to other types of experts and providers. One person in particular, her name is Shelly Belk. She's a mental performance coach. She created a series of just 3 different videos on different topics of mindset related towards ACL and the injury recovery process that we're going to be featuring within our app. And this isn't stuff that like we sell as a part of the program. It's just like you come in for the meat and potatoes of getting better with the ACL, but then you're finding things that's also going to help you get better on all realms. So give a little bit of taste of just kind of thinking about things better, getting a little takeaway. And if you find that that is a gap that you need solutions towards, here's this provider who could help you with it. We have a sleep specialist that also gave some info on that as well to help with the whole recovery piece through there. Because again, with this concept of not only training somebody to reduce their re-injury risk, but we're trying to train somebody to be a better athlete. There's so much involved with that. And we want to get more relationships with nutrition people to try and help do that type of thing as well, and even beyond. So I think it's a good landing spot for somebody to just really kind of broaden their horizons on so many things that's going to impact their life.
Yeah, and that's part of like the thing that you said, like you're excited for the future of what's to hold. And I'm assuming like bringing in all these factors to make sure every single component within the care of ACL is met. Like you said, sleep, preparedness, mental, what mental barriers. And I'm bringing like a very collaborative practice approach to the app. Have you gotten, I guess you said the goal was nutrition. Is there other aspects maybe of ACL care that people don't think about that you found as important after developing this program?
I wouldn't say as a result of developing the program, but more so just kind of landing that category of what does an athlete need? And in short, it's like everything. Support from all sides, from mental performance, that sleep aspect, understanding how to have better nutrition, and even like things that are like really specific towards their type of sport. That's something that we aren't able to provide right now in our app. Like this program is to help somebody be a better mover, but it's not training that soccer player to do more specific and better ball skills. That's that 20% that we hope that they're going to be getting outside of there. But in theory, like as these things progress, you can get connected with that soccer expert who's going to be able to kind of take off where we left off and kind of train those things specific towards those people. So those are like those cool long-term visions that can be birthed out of these mobile solutions that I hope that one day I get there.
Certainly the beginning. And you mentioned mobile solutions, and things I see over and over again are rehab professionals and other, healthcare professionals going to a mobile or online service. Do you feel like the field is going into that, and that rehab will more or less be maybe like a hybrid model of both online and in-person rehab? Or do you feel like it's going to be very specific to the patient? I guess maybe comment on what you believe the future of rehab looks like in regards to just mobile and online.
Yeah, like you're never going to be able to take away the value that a provider provides, but I do believe that there's a lot of room to enhance that through things outside of that provider's immediate reach. What that's going to look like, how far is that pendulum going to swing? I think it's possible that it could swing too far into one direction and then kind of get that equilibrium going forward. But as with so many different evolutions that we've gone through, like the internet and et cetera, like that technological marriage is overwhelmingly positive, but how long does it take to get there? And how much pain does the change provide in regards to just kind of learning how to do it the right way, and just all the different stakeholders and what their interest is with it, is how is that going to create that end product? So I do think that we're moving towards that side. I think that there's a lot of right ways to do it, and I'll be vigilant for opportunities that kind of come up along the way.
Do you think early providers, or even like students who are looking to get into physical therapy or healthcare, should get involved, or at least curious about some aspect of some kind of healthcare technology or some kind of aspect, whether it be video editing or even coding? Do you think a lot of healthcare providers need to start looking at this now, or do you think it's something that we have a little bit of time for?
Man, like going through just my individual journey has really, really opened my eyes in regards to, like, we are trained in such a valuable skill, such a now valuable like knowledge set, but you don't see too many people who come out of PT school who are capable of video editing or doing things more so in what would be quote unquote considered that creative realm, the coding, those types of things. And I think the more people who do get those types of skills compounded on each other, like there's so much opportunity for them to take our knowledge, our background, and just disseminate it in ways that relate to people better. So resoundingly 100% yes, I think that is a very valuable skill that more people are going to end up doing.
Yeah, and I think physical therapy is a great foundation for many aspects of life, and that's what brought me to the profession. I believe is that the versatility of it, right? Like we could always go back down to acute care, or we could do neuro, we can do TBI, or we can again go to where we're talking about the sport realm of things, or get into some of the creative side of whatever you want to do, whether it's working with a tech company or doing whatever you really would want to. And I think that skill set of working with people, understanding the human body, and understanding how to make the body, to use your word, resilient, I think is a very useful skill set.
Yeah, agreed, 100%.
Well, where can people find more about the ACL Pro, and is it available to everyone? Is it on all able to get on any device, and what does it look like in regards to price as well?
Yeah, so it is a web-based application, meaning that you're not going to find it in the App Store, but you go to the website, which is aclcarepro.com, and people are able to download it on their phone, and it functions fully as an app, whether it's an Android or Apple phone. So really, really cool synchronization of those two things. And I don't have to pay Apple for when people start to use it, which is nice. And as far as pricing goes, we currently price it as $150 per month across the 4-month process. And to learn more about just our programming in general, outside of the website, we have a robust Instagram account, ACL Care Pro, that just tries to educate, push more information about what this return to play phase is all about. So that's all good stuff for the consumer, for clinicians as well. And as far as like clinicians trying to utilize this stuff, like I think that the biggest draw is to do better for these ACL patients. But I know that there's more to it than that. And we offer like reimbursements for clinicians who want to use that as ways to kind of refer. You get referral bonuses and things like that to just try and help promote more people just learning what this is all about. So always feel free to reach out to us for it.
A lot of great information on there. I've already checked it out myself. And of course, links, everything will be below. Well, Akil, I really appreciate you coming on the podcast, sharing everything that you've known, you've experienced. And, you know, I'm super happy that you've really found this creative side of yourself and really have dived into what you believe to be a great aspect of helping patients and blending it all together. So congrats on that. And we're winding down towards the end here, and we're getting towards the health me to help you portion of the podcast, where we ask the same 3 questions for all my guests. I gave you a little time beforehand to read what the questions are. So are you ready to answer the questions?
Yeah, man, bring it on.
All right. First question. If you had the attention of everyone in the world for 30 seconds, what would you say?
So I gave Mike a hard time on this one because it was just a really hard question, but I did have some time to think about it. And for the entire world, I think a concept that I would try and talk about is that, like, people really hate what they don't understand, whether that's different races, religions, cultures, you name it. Like, there's so many misconceptions in the world. And I think that a lot of it boils down to just not really being able to put yourself in that other person's shoes. People go through that a lot. I mean, I'm here talking to you with a mohawk on my head, and you see some people come inside the clinic. Who knows what goes through their head when they see that, but I love it. So take some time to try and build some empathy. That's what I'm sticking with.
Love it. I love empathy. Love that idea too. Second question. What book do you recommend, whether a book you're reading now or in the past?
Mindset by Carol Dweck. It's a very popular book. She's a well-known psychologist who speaks about the concept that what gets people to be successful is not necessarily their intelligence, talent, or their education. It's really like the mindset. Are they capable of just being what she considers to be a growth mindset, getting over that next barrier? Or are you somebody who feels like you just fit into a certain category and you can't move outside of it? So that is the category of entrepreneurship right there.
Yeah, I think you're the second person to recommend that book. So I think I'm gonna have to definitely take a listen now, or read it. Or I'm more of a listener. Well, who am I kidding? I'm not gonna read it. I'm probably gonna do audiobooks, but I'll have to take a look. And then again, link for that will be below as well. Where can people more learn from you? And you've already mentioned the ACL Care Pro, Instagram and the website. But how about yourself? Where can people learn more from you?
So that's really where I communicate the most. If people are interested in seeing a bunch of random baby photos, because I'm a new dad, and some bodybuilding self-motivation, you can look at my personal Instagram page, AP the Boss or Akil Piggott. But otherwise, check us out on ACL Care Pro.
And you're also on LinkedIn as well. So I'm sure other healthcare professionals can also check it on there. It's a great way to connect with other healthcare providers. So he is also on there as well. All right. Well, Akil, thank you again so much for coming on the podcast today. I really appreciate it.
This was awesome. Thanks, Mike.
No worries.